The growing number of positive cases indicates that the containment measures are not fully adhered to. We have observed that many of our people are going about their everyday activities as if we are in normal times. There have been cases of illegal gatherings, such as house parties in various counties, with people paying no regard to the need for social distance or wearing of face masks. Operators in the transport sector have gone back to the old ways of doing business. We are currently witnessing overloaded vehicles, particularly in rural settings, with border operators carrying more than one passenger. These are practices that require personal responsibility by all of us. The expectation to have an enforcement officer to police every person is not possible. We must therefore rise up to the occasion and be responsible citizens, failure to which this disease will spread even deeper within our society and leave a trail of destruction. Ladies and gentlemen, moving on now to our COVID statistics of the day. We tested 4,228 samples over the past 24 hours. These samples came from 37 counties. The top 10 counties accounting for these 4,228 samples are Nairobi, with 43.7% of the samples, Mombasa, 12.2%, Narok, 6.5%, Busia, 5% of those samples, Nandi, 4.8%, Nakuru, 3.8%, Kajiado, 3%, Kisumu, 2.9%, and Turkana, 2.3%, and Makueni, 2.2%. This is where the majority of the samples, 86.4%, came from these 10 counties. The other 27 counties collectively accounted for the balance of 13.6% of the samples. Of the 428 samples tested, 309 were positive. The total caseload in the country is now 7,886. And the total number of samples that we have tested so far is 189,263. With the exception of 7 non-Kenyans, the rest of the positive cases are Kenyans. 217 of these cases are males, 92 are females. The youngest is a 1-year-old infant, the oldest is 83 years old. The distribution of cases by counties is as follows, again according to the number of positives detected in each of these counties. Nairobi with the largest number of 193 positives, Kajiado 22, Kiambu 20, Mombasa 18, Makueni 17, Busia 11, Machakos 9, Nakuru 8, Nandi 3, Turkana 3, Narok 2, Nyandarua 1, Kakamega 1, and Kilifi 1. If we go below the county level and look at the sub-counties, in Nairobi, the 193 cases are from Langata, 56, Kibra, 18, Westlands, 15, Dagoretti North, 13, Kasarani, 13, Ruaka, 12, Embakasi East, 11, Embakasi West, 11, Makadara, 10, Starehe, 10, Embakasi South, 6, Kamkunji, 6, Roysambu 5, Embakasi Central 4, Laboratory South 1, Embakasi North 1, and Madare 1. In Kajiado, the cases are in Kajiado East 13, Kajiado North 6, Kajiado Central 3. In Kiambu, the cases are 20 cases come from Ruiru 9, Kabete 5, Kiamba 2, Kikuyu 2, and Kiambu 1, and Thika Town 1. Mombasa's 18 cases are from Vita 8, Jomvu 6, Changamwe 2, Likoni 1, and Nyali 1. In Makueni, all 17 cases are from Makueni West. In Busia, the cases are in Teso North 6, Teso South 5. In Machakos, all 9 cases are in Athi River. While in Nakuru, 8 cases are in Naivasha 3, Gilgil 2, Nakuru East 2, and Nakuru West 1. In Nandi, the cases are in Mgwen 2 and Nandi Hills 1. In Turkana, all 3 cases are in Turkana West. In Narok, the cases are in Narok East and Narok North, 1 case each. In Kilifi, the 1 case is in Malindi. In Nyandarua, 1 case is in Ol Kalou. And in Kakamega, the 1 case is in Lugari. We are also glad to inform you that 51 patients have been discharged from the various hospitals where they were receiving care, bringing the total number of recoveries to 2,287. Once again, we want to appreciate our healthcare workers who have been working tirelessly and selflessly to make this achievement possible. It's unfortunate that we have also lost 1 patient to the disease, bringing to 160 the total number of deaths in the country. Our heartfelt condolences go to the family and friends who have lost a loved one. In conclusion, I want to remind our people that it is of utmost importance that we observe the containment measures. There is no silver bullet against this virus other than adhering to these measures. Any laxity can spell disaster for us in the coming days.
Remember at the beginning, I informed you that every county was advised to identify a COVID facility, a COVID treatment facility. The aim of this is to try and maintain those who are calling level 5 facilities for other health needs. For the sake of continuity of healthcare, those level 5 facilities in most counties are still available for the other services. So COVID has not stopped the provision of healthcare services in the counties. And you bear with me, and you'll be a witness to this, that if you visit most counties, they have designated COVID centers where they'll be channeling their COVID positive cases. Most of these cases, you are aware, have been managed under home-based care protocols. So any case that may be turned away, we need to know, because we do not, our duty of care is to avoid mortalities. As much as possible, our duty of care, I repeat, is to avoid mortalities. So any cases that have been turned away, we need to be told where they are so that we can respond appropriately. Because as I am aware, there are still beds available in most counties, including Nairobi. So no case should be turned away from hospital as we stand today.
Information on the ground, we have some counties that have ventilators